Now, how is hepatitis B or C evaluated by the doctor? Okay, so there are 5 things in this. One, the patient's symptoms are monitored. We all know that symptoms happen quite late in this disease, and if at all they happen, they should be picked up early. One of the symptoms is jaundice, which could be yellowing of eyes or yellowing of the urine. Patients may come with protruding abdomen, which may be filled with fluid. Patient may come with swelling in the legs, or patient may have extreme tiredness, weakness, weight loss. Patients may come with blood vomiting. Patients may come with low hemoglobin, or certain blood tests may give some idea. For example, low platelet count, which exists for a long time, or they may come with scan reports saying that spleen is enlarged, liver has become smaller, and so on. Now, the second thing is examination of the patient. So things which we look for are jaundice, presence of ascites, that is fluid in the abdomen and the degree of the fluid in the abdomen, presence of any dilated veins which may exist over the abdominal wall, any hernias that may arise in the abdomen. There may be signs of fluid overload in the form of the legs being swollen, lungs being congested, breathing difficulty, and patients may appear malnourished. Certain sexual organs might become enlarged, certain other organs may become smaller in size, and so on. Now, the third thing which the doctor looks at is the test reports. So, one is doing blood tests where the activity of the virus is looked at. In fact, the viral load, that is the quantity of the viral particles which are there in the blood, is measured on a periodic basis. The liver function test is seen where various parameters of the liver's function are assessed. We also look at tumor markers which can pick up cancers in the liver at an early stage. Now, the next thing is having a look at the ultrasound and similar imaging methods. The ultrasounds can give us an idea if the liver is shrunken, whether there is fluid in the abdomen, in advanced cases whether there is mass in the liver. If we add Doppler to the ultrasound, we can know the blood flow pattern to the liver, whether that main blood vessel supplying the liver called portal vein is blocked or not. We could have a look at various alternate channels which open up inside the liver, which are called collateral veins. And one could do a fibroscan, which also tells us about the stiffness of the liver and grades the stiffness in the form of fibrosis score. Now, that can give an early indication of cirrhosis developing in a. Sometimes we do ask for CT scan or MRI if we need more information on the liver condition or if we suspect any tumor in the. Now, monitoring of other aspects is also a very important part. This is the fifth component. So, basically, these patients continue with the gastroenterologist for many years for monitoring. So, counseling is given to avoid injury to the liver in any other form. For example, alcohol or because of fatty liver. So, patients are advised to have appropriate weight and avoid fat consumption or pure carbohydrate consumption, or limit it, and limit or avoid alcohol totally. Now, they're also encouraged, if there is a need for vaccination, then they need to go for vaccination. General health is also looked at. These patients may go through phases of advancement of the disease when psychological support may also become necessary.